is National Stroke Awareness Month. It is the 5th leading cause of death and the top contributor to serious long-term disability in the United States. And it can really happen at any age. The good news is that stroke death rates have fallen significantly over the past 20 years thanks to better prevention and treatment.
Dr. Nour is a vascular and interventional neurologist at UCLA Health, and she's here this morning to talk about how people can reduce their risk and the positive developments in patient care. Doctor, thank you so much for being here.
It's a pleasure to be here with you.
Always great to have you. We want to ask you, for folks out there who may not be familiar, there are two types of strokes. Can you tell us what are they and how can you tell the difference?
Absolutely. So strokes can either be ischemic in nature, where there's a lack of blood flow to the tissue of the brain, or hemorrhagic, where there's bleeding into the tissue of the brain. The majority of stroke is really that lack of blood flow or clots. And about 13 to 15% is where there's bleeding. They will present exactly the same.
Really?
Somebody may have weakness or numbness or tingling or inability to speak, but the really big hallmark about hemorrhagic stroke is that patients have a lot of pain. So they may have pain, nausea, vomiting, headache, and that is a sign of hemorrhagic stroke.
Oh, wow, yeah. So we know that time is so critical after a stroke. Every second really counts. Can you talk about what are some of the signs of a stroke and how can people react quickly if something like this happens?
Yeah, we always like to remind of the acronym B FAST.
Be fast.
B stands for changes in balance.
Okay.
E stands for changes in eyesight. F stands for changes in face or facial droop.
That's right.
Okay.
A is changes or lack of strength in arms or legs. S, changes in speech or language, and T is always time to call 911. That's what we want to enforce. Stroke is time sensitive. Don't wait at home and don't say, I wonder if this gets better in the morning. It's really time sensitive that patients come in.
That's a good acronym.
And I feel like we learned, we recently had Dr. Sandra Leon, who went through a stroke, and she herself said she waited, too long to go in. So this is great information.
Absolutely. And Dr. Nour, fortunately there are a lot of advancements helping stroke patients, including UCLA Health's mobile stroke units. This is so amazing. Can you tell us about that mobile unit and the progress that's being made right now?
Yeah, we're very, very proud. We're in almost our 10th year of operating the service. We started as a public-public partnership between the LA County Board of Supervisors and UCLA, UC. And we talked about the concept of time, right?
Right.
So here we are bringing the hospital to the patient, a hospital on wheels. And in the ambulance, we can immediately diagnose stroke by taking a scan of the brain.
Really?
And then treat the stroke symptoms.
Spot.
Just on the spot. And then we take the patients to the most appropriate hospital. So we work with over 30 different hospitals who are stroke centers within our county.
Amazing.
So we were reading recently, people under the age of 50 are having a lot more strokes. Why are we seeing this?
Yeah, that's a great question. Actually, in the last couple of decades, we've seen a bit of a rise in stroke under the age of 50. And so we can say 1 in 7 under the age of 50 will have a stroke. And you wonder why. Usually stroke is a disease of above 65. But it's really because of uncontrolled risk factors. Uncontrolled high blood pressure, cholesterol, sleep apnea, tobacco and tobacco-like products. All of these things are, many of these things are preventable. We should say 80% of stroke is preventable.
Really?
And that's why knowing the risk is so important.
Well, let's talk about that. This is, I guess, one of the positive things, right? This is 80% preventable. So for folks out there who may not know, what can we do to lower our risk?
Absolutely. So everybody's risk is different, right? So there are common risks: high blood pressure, high cholesterol, diabetes, and if we can control some of these risks, and I can tell you 2 things people can do today. Stop smoking and exercise.
Those are good things to do in general. Dr. Nour, thank you so much for being with us. I also love that your name is May, and May is Stroke Awareness Month.
We're saying it's
like
meant to be.
Meant to be as a neurologist. So
Such
thank you
a
so much
pleasure to be here with you.
Appreciate it.
Thank you.